Hi, I'm Dr. Ben Holloway, one of the partners and owners of Brewer Dental Center here in Billings, Montana. Today I'd like to talk with you about implant-supported dentures. But first of all, let me start off by saying that if you currently have your natural teeth and you're contemplating going into dentures, what I would really like you to think about is keeping those natural teeth. Your natural teeth are far superior than most dentures that we can make that really can mimic, as far as aesthetics, functioning as far as chewing and speaking. Your natural teeth are far better when it comes to that. Every now and then we can, take a denture and we can improve the aesthetics. Sometimes chewing, if you're missing a lot of teeth and you really don't have anything to chew with, then sometimes we can improve that. But if you have most of your natural dentition, your natural teeth will definitely work better. So if you can save them, do it. Sometimes it's more expensive that way, and that's what oftentimes causes somebody to maybe go to a dentures because of cost. But our patients are far superiorly happy when they keep their teeth, long term. Their way of life is far better when it comes with those things. Now, if you are currently in a denture and you're dissatisfied with it for whatever reason, whether you can't function with it, can't chew with it, it's hard to speak with it, or you're really contemplating going into dentures because that's your only option, then what I would suggest is that you go into an implant-supported denture. Now, what do I mean by that? I have some models here. We've got a model here that is a model of a jawbone that shows no implants basically in there. This would be just every natural jawbone with no teeth that have been removed over time. This model here would be one where we've placed maybe 2 implants. Now 2 is typically the minimal. Oftentimes we can place more or need to place more depending on the individual. But you can see the implants in there with these little studs kind of poking out there. That's what's used to attach the denture to. Now as an iteration here, so you can see if we had this jawbone and the denture, we place the denture in the mouth there. You can see with nothing supporting it, it does have a lot of movement. You can see it moving up and down, so you can imagine trying to chew on those front teeth. That denture's not going to really stay in place. Imagine the tongue sitting down in here, pushing and moving this all around. It is not going to stay put very well. And we find most people do not like lower dentures when it's like this. This is our biggest problem with dentures. You can see it's very easy, comes in and out, nothing really holding it in place. Now you take that same jawbone, same denture, put at a minimal 2 implants in there, and then in the denture you can see the little housings inside where those implants will attach. We take that, and in here you'll actually probably hear it snap into place. Now we attach them in there. You can see here I'm pressing very hard here, and we don't have that same movement that we did without the implants in there. We can't really just take it off very easily. In fact, you can see that holds it right in place, does not come in and out. So when we have that retained, we can at least mimic a little better with natural dentition than we can with a denture with nothing supporting that. This does give you a little better ability to chew. Sometimes can help you speak a little better because it does stay in place. So it does improve it. Again, not better than we can do with natural teeth, but something that certainly is better than just going with a denture with no implants in there. There are many options when it comes to placing implants for dentures. As I said, you can start with a minimum of 2. Oftentimes we can go up to 6 implants if we want to have that really rock solid. There's many options in there. So if you're one of those individuals that are really dissatisfied with your denture, you want to look at something that can help retain them a little better, or if you really can't save your teeth and you've got to go into a denture, really look at going into one of these implant supported dentures. And we'd love to have you come in. We can go over all the options that we have with dentures, with implants, get you on the right path and help you get what you want out of it, and inform you, as far as what the best way would go. And remember, if you call us in the morning, we'll get you in that day guaranteed. Thank you.